This next case involves stenting and angioplasty of an asymptomatic internal carotid artery with distal filter protection. This case involves a 57-year-old male who underwent medical evaluation prior to orthopedic surgery. He was found to have critical left internal carotid artery stenosis in the range of 90%. He required elective treatment of his carotid artery, and due to his high risk of CEA due to the contralateral ICA occlusion, it was deemed stenting would be most appropriate. As you know, contralateral occlusion is a NACIT high-risk criteria. Here we can see on non-invasive imaging critical stenosis of his carotid artery on the left side. On the angiogram, we can see distal guide access in the distal common carotid artery with severe stenosis of the left internal carotid artery just distal to the bulb. The first step, once access is accomplished, is to gently cross the stenosis without disturbing the plaque. Here you can see we cross with a very subtle shape on the wire. And as we get the wire distal, we then bring up the filter. Once the filter is in a straight segment or safe landing zone distal to the lesion, we deploy the filter, as was seen there, and now we can bring up the stent. Over the wire that was used to bring up the filter, we then bring up the stent and cross the lesion and make sure we're both distal and proximal to the stenotic segment when we deploy the stent. Here we can see we're deploying the stent both distal to the lesion and proximal, so we're in clean vessel. When we have adequate deployment of the stent, we do an angiogram to show the stent is well opposed. Given the waste in the stent, at this point it necessitates balloon angioplasty. As is shown here, the angioplasty balloon is brought up into the stent and the waste is reduced with near complete resolution of the vessel lumen. And the next step now is to capture the distal filter, as is seen here with the capture catheter capturing the filter and preventing any release of debris potentially causing a TIA or a stroke. Once the filter is captured, both the filter and the wire are removed through the capture catheter, and final angiogram are completed, demonstrating excellent resolution of the stenosis and excellent filling of the intracranial circulation. This concludes carotid angioplasty with distal protection using a filter.